how to break down a disease process. So what is a disease process? Such as like hypertension, asthma, all those different types. You know what disease processes are. So first we're going to start off with the pathophysiology of it. What is happening in the body? You need to refer to your anatomy and physiology notes, okay? Then we're going to discuss your diagnostic procedures. How is this disease diagnosed? Also the lab values that go with it. So as we talked about in the last lesson, it's not good to just know your lab values, but it's way more important to know what the lab values represent, if they're high or if they're low. Risk factors. These are high risk populations. What puts someone at risk for this disease? So as you're going to learn how I work and how I teach, is we always want to know the how and the why. I'm constantly asking, why is this happening, or how could this happen? So those are two good questions to just keep in mind. Clinical manifestations. How does the patient look? So you'll hear me refer as, how does the patient look? That means, what are the signs and symptoms that the patient is presenting? Complications. What are some complications that can arise from this disease if it's not treated? Nursing interventions. What are you going to do as a nurse, and what can you expect the doctors to order?